And then I would say fourth and probably last, as far as really notable trends we're seeing, is behavioral health. I think that's one of the most important trends we're going to continue to see as more health systems are investing money and time into this sector, and there's an influx of new and planned behavioral health hospital and clinic development across the country happening right now, and it's only going to increase. As you're aware, there's a rising need of behavioral health pre-pandemic, but now it's even more amplified. I think I saw CDC release data, that was saying over 40% of Americans were dealing with mental health or substance abuse issues, specifically related to pandemic. So, I think just more and more focus is going to be centered upon behavioral health care, and it's going to be, around the virtual and physical health settings.
Today's podcast episode is with Jaime Northam, Vice President of Healthcare Development at Ryan Companies. Jaime shares how she is seeing healthcare systems designed with the future and adaptability in mind with regard to their spaces. She discusses trends she is seeing in healthcare development to include focusing on the continuum of care, centers of excellence, integrating telehealth, and an increase in concentration of behavioral health. Please enjoy the interview. Jaime, welcome to the Providers, Properties, and Performance podcast.
Thank you. It's great to be here. Thanks for having me.
So a while back, I had interviewed your colleague, Ann Sabolka, so the listeners have heard the whole story behind Ryan. I really wanted to delve into your career in the space, how you came to Ryan, and just talk about your background. So do you want to share your background with the audience?
Sure, absolutely. So I've been in commercial real estate for, about 22 years now, and I would say half of that's been in specifically in healthcare real estate. Most of the time that I have been in healthcare real estate has been with Healthcare Trust of America, Senior Vice President, and as you know, they're one of the largest medical office REITs in the country. I have experience in most sides of the healthcare real estate industry, including leasing, asset management, development, acquisitions, and dispositions. And during my time in this industry sector, I've also worked across 35 markets in the US. And how I came to Ryan, I think it was fortuitous. I've, being in the commercial real estate industry for as long as I have, I've often have run parallel paths with Ryan and have interacted with various team members over the years and have always held them in very high regard. To me, they were always, cream of the crop as far as development goes. And I always had the utmost respect for them as a company and, for the various team members working at Ryan. So I had development experience prior to getting into healthcare real estate. And I always had a passion for it. I love the creativity that's involved with it and, putting the entire deal together. And I did a little bit of it when I was at Healthcare Trust of America. So that just fueled my passion for development. So there was an opportunity with Ryan. They were really looking to expand their healthcare team. And it was perfect timing. It was right around the time of the pandemic. So it was a good time to make a switch.
Well, you said that half of your commercial real estate career has been in healthcare real estate. So what attracted you to move over to specifically focus on that?
Well, prior to when I got into healthcare real estate, I was doing industrial brokerage, and that was great. It was booming. It was around the time of 2005 to 2008 was kind of like it is now. Developers and investors were coming from all over the country to develop here, building 1 million square foot spec buildings, and it was pretty interesting. And of course, there was a big market crash around 2009, where a lot of development and real estate in general just came to a standstill, especially in this market. And at the time, I was working for a developer. I was working with the Alta Group out of Chicago. And as I evaluated, next steps and, where is the opportunity going to be? Where is there going to be some stability? Where am I going to see some activity? As I was contemplating a career change, really it was on the investment side. Obviously, there was a lot of assets that were turning hands, and two, it was on the healthcare side. It was about the time frame of the Affordable Care Act and all the changes that were coming as a result of that. And then you had, a lot of activity from even Stark regulations and hospitals looking to sell their assets and kind of get out of the real estate game. So tremendous opportunity. And at Healthcare Trust of America in 2010, which is when I started there, they were a really young REIT at the time, and they were headquartered in Scottsdale, and they were growing tremendously. So we crossed paths, and that's how I ended up there. And I think on top of that too, I've always had a passion for healthcare. I almost became a doctor or went that path. So it was very fortuitous, kind of blending my two passions. So once I got into it, there was no turning back.
So what prevented you from continuing your path in actual medicine?
Well, my father was a real estate attorney, so I had always, had exposure to that and was very familiar with it. I helped him out a lot, as long as I can remember, on my days off school or sick days, I was in the office working with him. So, I loved it, and I loved the idea of kind of continuing in his footsteps. So I think, if that hadn't been the case, I think I would have definitely ended up pursuing it. I almost took a change when I was in college and decided to, and go into medicine, but I had a couple opportunities to stay in that real estate sector, and ultimately that's what I did.
So we'll get back to the interview, but I thought that was interesting.
Sure.
How has the transition been coming from a publicly traded REIT to a developer?
Yeah, very different. Yes, very, very different. Working with a REIT, it's what I would consider to be a sprint, and a marathon at the same time. But you're working with a high volume of transactions and oversight of properties, all over the country, and they're really measured on a quarterly basis. So you're always working towards these quarterly goals, and it's exciting. I did love it. I love the excitement and the challenge that brought. Stepping away from that and getting into development, it's more of a marathon. The entire development process, from concept to delivery and beyond, it takes years, right? So it's a lot of cultivating of relationships and a lot of pivots and problem solving. So you're not seeing, that daily grind, like that daily high volume transaction volume that you see with working with a REIT, but it's just a different kind of busy, So, and Ryan, they're a private company, so they also, I think, one also differentiator is, the fact that they're so flexible with how they approach deals, how they can look at deals, how they can work with clients.
Well, and so you came on to expand the healthcare development. So what has been some of the initiatives that you've pursued, and kind of what is your strategy for your next 3 to 5 years at Ryan?
So, I think as far as strategy, it's a lot of relationship focused, and Ryan, they've been developing healthcare real estate for quite some time now, and especially in the Midwest where we're headquartered, and in the Southeast. But we really haven't done too much in the Western U.S. It's been a little bit more opportunistic, and so we really wanted to elevate that, and that's what I'm doing. And so it's really understanding these markets, understanding what the health systems are doing, what the provider groups are doing, and having these conversations. What are their needs? Looking at the overall strategy behind the health systems. Their short-term goals, their long-term goals. And helping dive into that with them, and just getting it out there who we are. I think one of the unique features of Ryan is the fact that we are a fully integrated platform, and we offer all service lines from strategic planning to development, construction, design, property management, capital markets, and acquisitions. And we can really lend a holistic and broad perspective when we're working with clients from the get-go. So it's been great so far. There's a tremendous amount of activity out there in multiple markets. I would say that there's 5 key trends that I'm seeing and we're seeing across the country, and we're trying to track those as closely as possible and follow the paths of these various trend-setting uses that are coming about. So first are the product types. That we're seeing a lot of ambulatory outpatient clinics, surgery centers, centers of excellence, specialty clinics, and patient rehabilitation facilities. Those are going to continue to be the fastest growing product types of healthcare. A lot of that is fueled by the desire for better community access to care, shifting certain care services away from the hospital setting, reserving the higher acuity care for the hospital. And we're seeing a lot of activity on campus as well, but those are mostly renovation and expansion projects as the hospital looks to make the space more functional, efficient, and versatile for the higher acuity care services. And then secondly, I would say we're seeing a lot of increased activity from physicians and provider groups, as you probably can attest to. More ground up development opportunities are being stirred up by physician and provider groups. This is a result of independent groups growing and expanding, as well as hospital affiliated physician groups doing the same. These physician groups and provider groups are often leveraging new capital sources and/or increased revenue streams. Or sometimes it's a result of changing reimbursements, new allowances by Medicare of certain procedures and surgeries in an outpatient setting, and even the relaxing of certificate of need laws in many states. We've seen a lot of activity stirred up by that. Just a few more trends because it relates to our overall approach in these markets. The other is the health system strategies are becoming more and more centered around the full continuum of care model. So all the way from preventative health and wellness to clinical care, acute and post-acute care, and rapid improvements in medical technology and more accessible virtual care and telehealth will continue to bolster those efforts in this regard. So that, of course, is fueling additional redevelopment and development opportunities. And then I would say fourth and probably last, as far as really notable trends we're seeing, is behavioral health. I think that's one of the most important trends we're going to continue to see as more health systems are investing money and time into this sector, and there's an influx of new and planned behavioral health hospital and clinic development across the country happening right now, and it's only going to increase. As you're aware, there's a rising need of behavioral health pre-pandemic but now it's even more amplified. I think I saw like CDC release data, that was saying like over 40% of Americans were dealing with mental health or substance abuse issues specifically related to pandemic. So, I think just more and more focus is going to be centered upon behavioral health care, and it's going to be, around the virtual and physical health settings. So that's,
yeah.
I'll turn it back over to you. I've been doing a lot of talking.
No, this is great. I had like 3 questions, but so
Sure.
with regard to behavioral health, I found it interesting that I think I have passed a handful of new behavioral health hospitals just in my driving around the Phoenix area. And what I like about them is that they're not like far into and into these like far away places. They're actually inside of neighborhoods so that the family can continue to interact with them. I'm assuming is one of the reasons that they're located there, because the last thing you want if somebody is dealing with a mental health issue is to have them feel more isolated. So I think that's
right.
They're integrating it into a community. So do you, we'll get into, I want to talk to you a little bit about the pandemic, but I want to kind of comment on a couple of things you said. What are you seeing, or what is your take? Because on the you said there's a lot of renovations in the hospital. So as hospitals find themselves no longer functional for how they want to deliver medicine efficiently, or things are just sort of dated, are you seeing hospitals wanting to make changes in that regard, and as well as like some clinics are really old?
Yes, definitely. I would say it's all across the board, seeing changes and renovations to the hospital and patient rooms, the ER, emergency room renovation expansions are really, really active right now. Seeing a lot of them. And it's, I think the pandemic shed a lot of light on the deficiencies of how care is delivered in the hospital setting, and the need for it to be more flexible and, be able to accommodate varying levels of acuity. And then even, bringing in the whole virtual health variable too, that's obviously something that they're thinking about more, and how they can leverage that in the inpatient setting as well. So, making more space for that, for, these telehealth visits, and even the concept of virtual waiting rooms and triage. And then I think another focus that I've seen, as well as, the better infection control and better ventilation. So a lot of upgrades to the MEP systems within the hospital setting and the clinical setting too.
Absolutely. And I think you're right with, the volume of people that they had to triage through the emergency room through the pandemic. I think they kind of learned a lot how they need to be set up in order to efficiently triage the most critical from less critical, and be able to treat them. So, I get the question a lot where people are like, how has the pandemic affected healthcare real estate? And I say it had a blip just like everybody else, but it really came back because it's needed. You can't, healthcare facilities aren't going to shut down. And, the tenants have to be there. Has the pandemic affected anything that you guys do, maybe other than obviously construction costs and labor costs right now that you're having to manage? But as far as, has anything have any requirements changed from that are, you could say, are specifically pandemic related, in as far as how healthcare systems are developing projects? Or is it maybe just some changes in the way that they structure the space, but is there any size difference, or, is there height differences or anything like that?
In the healthcare specific space, I would say the life sciences space, yes, but if I'm focusing just on the healthcare space, I think it's still evolving, and and changing. It's definitely part of the conversation now, is how can, especially when they're building new spaces or redeveloping, it's how can we make these spaces most flexible and to be able to accommodate their current needs and then any future needs as they grow and change or adapt their strategy. There's still so much in flux right now with what that strategy looks like on a short-term basis, on a long-term basis. So there's a lot of conversation about it, but I wouldn't necessarily say there's one, a couple like very specific things that we're seeing right now. I would say it's just more, it's just all about flexibility. That's just so important, not only on the design side and the real estate side, but also the deal structure side, just having that flexibility with, being able to pivot and, and be able to incorporate, different needs in the future with health systems and provider groups too.
So like they do, hey, this is our plan A, but if this doesn't work or we need to use it for something else, we need to have something in mind for what it's going to be absorbed into.
Yeah.
Sort of.
So that's, yes. So, we see it a lot of it in the design. So accommodating, the design. So it's, certain spaces can be used for, exam rooms, or it can convert into, physician office or some other need. So it's not just one defined space. And same with the flow of the space, and where nurses are and where the providers are. It's just very flexible and also more of a, I would say, like an open layout, open format.
So you can see more of the patient activity that's going on.
Yes, exactly. Yeah, interestingly, I was in a hospital recently with my mom at Mayo Clinic, and we were in the PCU, which is one step down from the ICU, and I was talking with a nurse there, who she's a traveling ICU nurse, and this is during the height of the pandemic, so you could just see in her eyes how exhausted she was. But she was talking about how it's actually been frustrating at times when they're not, some hospitals are better than others, but when she's seen certain hospitals across the country, they don't really have a conversation with their staff or really leverage their staff and their experiences and caring for the patients when they're thinking about the design of the space. And in one instance, there was a brand new ICU that was constructed, and beautiful space. However, it ended up not being very functional at all because they did not have any patients in their line of sight. And if they were in a room caring for a patient and one of them coded, they couldn't easily yell out to one of the other nurses for help because they weren't in a direct line of sight. So it's those little things that they're just, I think it's more and more important that a lot of thoughts put into that. And again, I think the pandemic really shined a light on that, right? Like, because there was a lot of chaos and constantly having to rethink of how you're going to deliver this care.
Yeah, I think the nurses are a great resource because they're the first line of defense and they have to coordinate everybody else. So seeing how, getting their input and how they can manage many patients at the same time, I think would be key.
Yeah.
Great. Well, Jamie, we're going to move into the Q&A part of the interview.
Okay.
So we'll get to know you a little bit. What was your first job?
Okay, so I think that was in high school. My first real job was in high school, and I was a legal assistant with Snell and Wilmer, which is, at the time, it was the largest law firm in Arizona. And I worked for 10 different attorneys across all different industries. So I think I had a patent attorney and a real estate attorney, litigation attorney. So it was a great experience. I loved it. Never a dull moment. But it gave me some good perspective.
I see you didn't go into law.
I didn't, and maybe that's why.
What would you be doing for a living if you did not have a healthcare real estate career?
Well, definitely medicine or medical research of some sort. Yeah, ever since I was a little girl, as I mentioned before, I had always wanted to be a doctor of some sort, and even in my career, even before I was in healthcare real estate, I was always, involved in some sort of healthcare charity or research initiative, because I just wanted to learn as much as I could about it, and I was always fascinated by medicine and the science behind it.
Who are you reading or listening to right now for news, information, or inspiration?
Oh, let's see. Well, I mean, other than your podcast, right? That's all we need. Well, needless to say, I love reading health journals, so I do read my fair share of those, and of course, the various healthcare real estate industry publications across multiple markets. For other news, it's a mixed bag. I would say it's a variety of different news sources and publications, just trying to keep current on all the various events and issues, but trying to have multiple perspectives about it. And for inspiration, I would say it varies on my mood, but I love music and rely on listening to music a lot for inspiration. Lately, it's been classical or jazz music that gives me what I need, but of course that can fluctuate. I also love a good inspirational book or magazine. And lately, I've been finding inspiration in my 3-year-old son's children books. So I'm like, who knew? I forgot about all those simple, yet powerful messages a lot of those books have. And, I think we all need to be reminded of those from time to time, no matter how simple they are. So yeah, I've been enjoying that unexpectedly as well.
I think they try to make them now to entertain both the parent and the child
a
little bit.
Yeah, very, very smart of them to do that. Especially when you have to read them over and over again.
Exactly. What is one thing you do every day for healthy self-care?
Definitely, I get exercise in, so about 30 to 60 minutes of exercise, preferably outdoors. So when it's not 120 degrees outside, I usually will go out for a jog or a brisk walk, at least once a day. And then, I would say just creating and cherishing all the sweet moments I get with my little toddler. We read, sing, and snuggle together before bedtime every night. And I would say that there's no medicine, exercise, or food that gives me the level of joy and endorphins I get from that. So, and then of course, after I put him down, I love relaxing via a good book or bath. So got to have that.
Yeah, totally. So do you think leaders are born or trained?
That's a good question. I would say it's both, and there's always room to grow. I think you can be a born leader, but just because you're a born leader doesn't mean that you can't get better. And And I think it's definitely something that you can learn and continue to grow into.
Yeah, I think it's something you always have to keep working on because things always change.
Yes, always change. You have to be very adaptable and have that emotional IQ that we all strive for.
Well, Jaime, thank you. This has been a wonderful interview. Thanks for your time.
Yeah, absolutely. Thanks again for having me.